So the hospice started about 27 years ago. A group of passionate people in the community decided they needed a hospice in North Hertfordshire. So started the mammoth task of fundraising the necessary funds, and 27 years later here we are. I enjoy working at the hospice because it's a real privilege to care for and interact with people and families that use our services. It's a privilege to be involved in people when they're at a difficult time in their life, and for some people towards the end of their life. So it's a real privilege to be around people, staff, volunteers and patients who we serve.
So the most rewarding part of my job is still being able to help patients and families at a really, really difficult time in their lives, and hopefully make something that's so difficult a little bit easier. We have a large nursing team, which is made up of both registered nurses and healthcare assistants. We have a team of allied healthcare professionals, which includes our physiotherapists and our occupational therapists, which work both in day services and on the inpatient unit. We have a team of counsellors, both staff and volunteer counsellors, social worker and spiritual care. And we also have a medical team which is headed by Dr. Sarah Bell, who's our medical director. All of the clinical services here at the Garden House Hospice Care are well supported by a team of volunteers with various skills, with particular reference to the Hawthorn Day services and the family support services, where we depend heavily on our volunteers to support patient activity.
I think the most rewarding thing is seeing people arrive. They're often quite anxious about coming to the hospice and what lies ahead for them, and they leave with a plan, feeling reassured and supported, and it's just lovely to see that change. We offer therapies, education and groups to improve people's health and well-being and treat the whole person. So it's important to people because we ask them what's important to you, and we find out what their priorities are, and then they attend different sessions to meet their needs.
So I'm responsible for the 210 staff that we have here at the hospice and the 540 volunteers, and we work out in the community recruiting volunteers for all of the services that we provide both in the hospice and out in the community. And so our volunteers give us over 90,000 hours of volunteering per year, and if we equated that to staff costs, it saves the hospice about £750,000 a year in staffing. They're the normality for some of our patients visiting this hospice. They're also the ones out there in the community knowing what we do, talking about the services we provide and fundraising those vital funds that we need here at the hospice.
I do a shift here in the beverage room, which enables me to meet the patients and their families, which I thoroughly enjoy, and is very, very rewarding, interacting with them at this most difficult time of their lives. And I got into it because a close friend of mine came in here as a patient, initially for respite care, but sadly did pass away here. I was thinking about volunteering because I was due to retire very shortly, and I was so impressed with the atmosphere, the care my friend got, and to see him at peace in his final days, that I thought this is going to be the place for me. So it all dovetailed quite nicely, and I don't regret it for a minute.